let's talk about Trumpcare. Could you perhaps for our listeners kind of just describe what it is and how it differs from the Affordable Care Act?
What it is a great question, actually. So the American Health Care Act, it is a bill written, as far as we can tell, literally in the office of Paul Ryan. It does not really have the committee process behind it, the normal congressional process behind it you would expect. It also, by the way, did not come from the Trump administration. Trump very quickly threw his support behind it, but this is not something that Secretary Tom Price created. It did not come out of the White House. It came out of Ryan's office, changed a lot right before it dropped, and has dropped to a very cold reception from both liberals and conservatives. The bill itself is a little bit strangely constructed. They are trying to do something very difficult, which is keep the bill in a particular Senate process or congressional process really, called budget reconciliation. The upside of budget reconciliation is it means you can pass something with 51 votes. So you cannot have a Senate filibuster or act against reconciliation. The downside of it is that for something to be part of the budget reconciliation process, which was built for budgets, that's why it has that name, it really, every specific provision has to be primarily related to changing spending or taxing. That is the test the parliamentarian applies. And what that's meant is that a lot of what we do in healthcare reform, no matter which side is doing it, is insurance regulation, is saying that insurers can, not do this or they have to do that. You're telling private market actors how to run their business. That is not considered material to the budget. That is not something you are doing to change the taxation or spending of the U.S. federal budget. And so Republicans have had to have a bill that actually does not change the bulk of Obamacare's insurance market regulations. It keeps lifetime limits. It keeps the essential benefits. It keeps tons of things Republicans have been complaining about forever. What it does take away, and this is important, is it takes away the individual mandate. And it replaces it with something similar but less effective called continuous coverage, where if you stop having insurance, whenever you come back, you get a 30% surcharge for 1 year, which healthcare experts think is going to be a big incentive if you're healthy not to buy insurance until you get sick. So that can make death spirals a lot worse. But then the two really, really big things it does, and this is a core of everything. Obamacare has two ways that it subsidizes insurance for people. One is Medicaid. And on the Medicaid side, what the Republican plan does is it allows states to sign up and enroll people in Medicaid until 2020. And then not just freezes that, but if one of those people gets too much money and is off Medicaid for 3 months, or they forget to sign a form, they can't get back on. So it freezes it and then tries to roll it back through attrition of the program. But the other thing it does is it cuts the Medicaid program in the long term hugely. I think, if I'm remembering the numbers right, by somewhere in the neighborhood of $600 to $800 billion. So over 10 years, the Congressional Budget Office says that's going to kick 14 million people off of Medicaid. The second thing it does is that Obamacare's subsidies in the private market are tied to two things, and people don't always realize this. They know the subsidies are tied to income, which is true, but they're also tied to the cost of a plan in your local area. So the way the subsidy is calculated is the law basically says, you, Jamel, make X amount of money, and we want that to cover Y percentage of a plan wherever you live. And that's really important because the cost of an insurance plan in Washington, D.C. is different than in L.A., is different than in rural Alaska, is different than in suburban Miami, in the suburbs of Miami. And so you have basically a subsidy structure that really guarantees that if you don't have that much money, you can afford a plan. The Republican plan wipes that out, and it moves to just flat age-based credits. You get one amount of money if you're 30 years old. You get another amount of money if you're 60 years old, a higher amount of money. And it does not matter how much money you make, and it does not matter how much a plan near you costs. If that tax credit cannot buy you a plan, you just don't get a plan. So the tax credits are over time about half the value of Obamacare's tax credits, in addition to not varying by how much money people make or how much you need to spend to get health insurance. So when you put all this together, the Congressional Budget Office, which are the big scorekeepers here, they came out with an estimate of what the plan will do that is as singularly devastating a document as I've ever seen in American politics. They said it would, over 10 years, kick 24 million people off of health insurance. That is how many fewer people to have health insurance. 24 million, just to put it in perspective. It's more people than live in New York State. It's more people than live in Australia. We are creating an uninsured population the size of Australia.
And it's more people than Obamacare covered in the time it's been in place, right? It says closer to 20 million people.
No, so I think by the end of this period, Obamacare would have been expected to be covering, if I remember, 32 million people.
Oh, all right.
So because we're projecting out into the future here. But so this is a really bad score. And so on the one hand, you have conservatives who are looking at this plan and they say, hey, this creates a new tax credit-based middle-class entitlement. Why are we as conservatives voting to give somebody who makes $50,000 a tax credit forever? That's not the government's role. So that's like the Freedom Caucus problem. Then you have what my colleague Andrew Prokop calls the Coverage Caucus, there are Republicans, many of them, who believe either that people should be covered or at the very least believe they do not want to be running for election having voted to take coverage away from tens of millions of people. That's your Susan Collins, your Lisa Murkowski's, that group of folks. And so on the one hand, you've got a bunch of Republicans who think this thing is not conservative enough. On the other hand, a bunch of Republicans who think this thing is an insane political suicide mission. And then in the middle of all that, pretty much every major Republican think tank has come out against this bill because it is just constructed like garbage. The thing was not well built. They did not wait for CBO scores. They did not get enough input. They're not running it through a real committee process where it's getting worked on and fixed and evaluated. The whole thing, it is so bad that a lot of people have speculated to me that Ryan wants this to fail. Paul Ryan wants it to fail. I do not think that is true, but it is hard to come up with what has created such a slipshod piece of legislation and such a fearful, cowardly, hypocritical, and fundamentally on a policy level ineffective process.